As you know, obesity is an important risk factor for sleep apnea. And I want to say it again, you don't have to be heavy to have sleep apnea. You could just be old or genetically predisposed or have big tonsils or be Asian or whatever. But obesity is a hugely important and one of the few modifiable risk factors for sleep apnea. So the comorbidities that go with obesity tend to be seen in sleep apnea, and by far and away the two most prevalent are diabetes and hypertension, which are associated, as you know, with obesity. It turns out, though, because your question was specifically what other pulmonary conditions are associated with sleep apnea, that asthma is as well. And it turns out that obesity is also a risk factor for asthma, and there are all kinds of reasons for that, from the just simply mechanical compression of the lungs and the airways by obesity to the little things that we can't see that are inflammatory mediators that are secreted by fat tissue. So asthma turns out to be pretty common in people with obstructive sleep apnea, and there is now an emerging body of evidence that says that a patient who has both obstructive sleep apnea and asthma will do better if that person uses CPAP. COPD, chronic obstructive pulmonary disease, bronchitis, emphysema, we'll lump it all together. COPD, certainly, which is a bread and butter pulmonary disease, also has significant overlap with obstructive sleep apnea. And in fact, the combination of COPD and sleep apnea is called the overlap syndrome. And there is now pretty good data that has come largely from Spain, showing that if a patient with COPD and sleep apnea uses CPAP, that person is less likely to die, which is kind of an important outcome. But also, almost equally important to the clinician and even some of the patients is that patient is less likely to have a COPD exacerbation. And COPD is a chronic, miserable condition, but the worst part of it for the patients is their exacerbations. When the disease gets so bad that something has to happen. They have to take an antibiotic, or they have to be admitted to the hospital, or they have to be in the intensive care unit. That is where the misery and that is where the cost of management of COPD comes in. And that may be each COPD exacerbation also does more further acute damage to the lungs and worsens the COPD. So we do see a lot of overlap with COPD and asthma in people with obstructive sleep apnea.